So we have Arthur on the left and Alan on the right.
Right.
And who was born first? Who's older?
I'm 2 minutes older.
Okay. So tell me a little bit about your childhood. Were you guys competitive?
We were I would say in a constructive, healthy way. I mean, we were competitive academically and in sports, but I mean in a good way. You know, nobody wants to lose, but we always like to beat each other, and probably helped us in school because I never wanted to, come in second. Although I got to admit, I typically came in just a slight second to Arthur in high school and college with our grades.
What about sports? Who's the better football player or swimmer?
I was probably the better football player, and Alan was a better swimmer.
Did you play football?
Yes. And I swam.
At what high school was that?
Jesuit in Tampa. We both went to Florida State for undergraduate, and then we both went to the University of Florida for medical school. And then after that, we split up. Arthur went to Atlanta for his orthopedic residency, and I went to Charlotte, North Carolina. Hollywood wants to make you guys your life story, and they only want to use one of you to play both parts. Who would be the better actor? Alan. I'm not so sure about that, but
I'd
be willing to give it a try.
Why do you say that, Arthur?
He dresses nicer and is more photogenic.
Stephanie, is it easy to tell the two doctors apart?
Yeah,
How do you do it?
I can tell them apart. Well, they have different hair. They just have different demeanors.
That is true.
Yeah, they have very different demeanors. Dr. Allen's very serious. Dr. Arthur is, he's serious as well, but I guess just
A little more relaxed.
Yeah.
A little more,
calm.
laid back. Yeah.
Mhm.
Yeah.
Is one a snazzy dresser and the other one kind of?
they dress
They both
exactly the
dress.
same.
Yeah, they dress alike.
Okay. Tell the two doctors apart. They're twins.
I can.
How do you do that?
That's a really good question. I think you just you work with them and you learn how to tell them apart. It's really easy for me now.
Like that, yeah.
So, Alan, has it been a rough day today? What'd you do today?
It was just another busy day in the office, but I'm grateful to be busy.
How many? Did you do any surgery today?
Today I was in the office, and Arthur was in surgery. We try not to be in the same place at the same time. It's too confusing.
So, Arthur, how many? Did you replace any knee joints today?
I did. I think 5 or 6 outpatient surgeries today, so no joint replacement, but some shoulders and knees and elbows.
Are you tired?
No.
You're used to it now.
Yeah, you just have a little energy. It goes a long way.
What are the patients like before and after? They must be grateful.
So orthopedics is a little different, that we don't typically routinely save lives, but we improve the quality of life. And people are very happy about that, right? So if people have a problem or an injury or a degenerative condition that we can fix and give them back quality of life, yeah, most of them are very grateful.